When I first initiated my research program 20 years ago, focusing on neurological conditions, I began to realize early on that the future of medicine was not going to reside in pharmaceutical medicines or even surgeries. The future is going to rest with the delivery of frequencies through light and through sound. Now, way back when, many years ago, I began saying, well, there will be a time when we will finally have some inventions, some devices that will deliver those frequencies to us in a non-invasive way, no side effects with enormous benefits. That time is here, I have to say. We had to wait 20 years, but finally we have a huge plethora of studies, and I'm amazed by how many that I find that are reporting that photobiomodulation, that's the delivery of frequencies through light, used to be known as low-level laser therapy, but they changed the name because nobody could agree on how low was low. This morning, I did a quick search on PubMed. That's the government website that tracks all the documented research on all kinds of medical options. And I found many, hundreds and hundreds of studies. I mean, that's 2024 that look at the application of photobiomodulation devices for treatment of many, many different conditions, and many of those focus on neurological conditions. I just want to read to you 3 of the 2024 studies, some of them just published a few weeks ago. Parkinson's disease and photobiomodulation, potential for treatment. Photobiomodulation therapy on brain, pioneering an innovative approach to revolutionize cognitive dynamics. Photobiomodulation for neurodegenerative diseases, a scoping review. I mean, that's just 2024. If we go back, we're going to pick up dozens and dozens, if not hundreds of studies. Researchers are on the bandwagon. So if you were to ask me, what would I recommend to anyone, depending on who they are or what their conditions are, what would I say? Just blanket. I would say 3 things. I'd say, first of all, exercise. Second of all, I would say diet. And third, I would say photobiomodulation. I really have to say the people that I know who have a diagnosis of Parkinson's disease report back to me it has beneficial effects. I do want to say that I have had conversations with now a handful of individuals over the last several weeks, and they will be telling me what their situation is, and I'll ask them, well, what kind of options are you using? They'll say, well, I do have this Vialite device. I'm thinking, oh, great, so are you using it? Oh, well, every once in a while. Well, listen, I know a number of you out there who are connected in have a photobiomodulation device that is from Vialite, which is the gold standard. Use it every day. It's not the kind of a device where, like taking medicines, you can sometimes all of a sudden, with some problematic symptoms, all of a sudden, finally, you're calm. No, that's not what you're going to find. You're going to find healing from the inside out. If you have a device, use the device every day. Take a break on the weekend, but 6 days a week, every day, please, I beg you, if you have the device, use it, please. And if you don't have a device, I just want to say, get one. There is a minimal risk, and by that I mean you get to use it for up to 6 months, and if for any reason you feel like it wasn't providing you with the return you would expect, you can get an 80% refund. I mean, the risk involved of getting a Vialite device is really minimal. Again, I've got, I guess, reports from persons in my audience that would suggest to me it looks like it's effective for about 9 out of 10 members of my audience. It's not perfect. It doesn't going to be able to help everyone. But I do know it's helped a lot of people. So please, seriously consider, if you haven't already gotten one, get one of these devices. Call up the Vialite people. They're wonderful. Ask them the questions about what might be something they would recommend. And I would just say, go for it. And then, of course, let me know the result.